Are my Kegel exercises making my bladder problems worse? You might have heard that doing Kegel exercises can help with bladder issues, but sometimes people worry they might be making things worse. The truth is, when done correctly, Kegel exercises are generally beneficial for strengthening the pelvic floor muscles that support the bladder and urethra. These muscles help control urination and can reduce leaks caused by stress or urgency. They are often recommended as a first step for managing urinary incontinence in both women and men. However, if Kegel exercises are done improperly, they can cause problems. For example, trying to stop urination midstream repeatedly during exercises can actually weaken the pelvic muscles over time. This habit can interfere with normal bladder emptying and increase the risk of urinary tract infections. It might also cause damage to the bladder or kidneys if done excessively. Another common mistake is engaging the wrong muscles. Many people unintentionally use their abdominal, thigh, or buttock muscles instead of focusing on the pelvic floor muscles. This reduces the effectiveness of the exercises and might even worsen symptoms like urgency or discomfort. Overdoing Kegels without proper guidance can also lead to muscle tension or spasms, which may make bladder urgency or pain worse. It's important to remember that some bladder conditions, like overflow incontinence, where the bladder doesn't empty properly, might not improve with Kegel exercises. In fact, tightening the pelvic muscles too much could make these issues worse. To avoid problems, learn how to identify and contract only your pelvic floor muscles. You can do this by trying to stop urination once or feeling muscle movement during a pelvic exam. Never do Kegels during urination, and stick to a routine of tightening the muscles for a few seconds, then relaxing, about 10 times, several times a day. Consulting a healthcare professional or a pelvic floor physical therapist is highly recommended. They can teach you proper technique and help customize exercises based on your specific bladder health needs. If you have a history of bladder cancer, pelvic surgery, or other complex issues, professional guidance is especially important. In summary, Kegel exercises are a helpful tool for many bladder problems, but only when performed correctly. Doing them improperly or at the wrong time can potentially worsen symptoms. The key is proper technique, moderation, and professional advice to ensure you are strengthening your pelvic floor safely and effectively.